Good morning, everybody, and can I welcome members, officers and the public watching on the webcast to today's meeting of the Fire Resilience and Emergency Planning Committee. Members of the public might like to follow at London Assembly on Twitter and use the hashtag AssemblyFire for this meeting. In accordance with government regulations, we are holding this meeting on a virtual basis with Assembly members and guests participating remotely. Could I ask everyone to check that their electronic devices are switched to silent mode and their microphones are switched to mute when they're not talking. On behalf of the committee, can I take this opportunity today to congratulate the firefighters who were included in the Queen's New Year Honours List. Principal Fire Engineer Lindsay Seal awarded the Queen's Fire Service Medal, and firefighters Ashley Gordon, Lisa Barker and Harry Aquilina each awarded the British Empire Medal, richly deserved recognition of their devotion to duty and distinguished service. On a more sombre note, the committee wishes to condemn the unprovoked attack on the London firefighter last week and to send its best wishes to the firefighter involved. All such attacks on emergency workers are completely unacceptable, and the committee knows that the brigade is working with the Metropolitan Police Service to ensure action is taken. Our main item today is a question and answer session with the London Fire Commissioner and the Deputy Mayor for Fire and Resilience, but we have a few short items of formal business to go through before we begin this discussion. Can I now ask our clerk, Diane Richards, if any apologies have been received for today's meeting and to confirm members participating?
Thank you, Chair. No apologies have been received. In attendance on the call today are yourself, Assembly Member Dismore, Chair of the Committee, Assembly Member Hall, Deputy Chairman of the Committee, Assembly Member Arbour, Assembly Member Cooper, Assembly Member Curtin and Assembly Member Dr. Moore.
Thank you. This will be the last FREP committee meeting for myself and for Assembly Member Tony Arbour, and our thanks go to Assembly Member Arbour for his years of work and scrutiny on fire services in London and indeed on London as a whole. Can we go on to declarations of interest? Can I ask the committee to note the recommendations set out at item 2?
Noted.
Are there any other declarations? No. Minutes. Can we confirm the minutes of the committee meeting on the 16th of December 2020?
Agreed.
Thank you. Summary list of actions. Can we note the completed, outstanding and closed actions arising from previous meetings of the committee and the additional correspondence received as listed in the report? Is that agreed?
Noted. Agreed.
Thank you. 5. Action taken under delegate authority. Can we note the recent action taken by me, the chair of the committee, under delegated authority, following consultation with party group lead members to agree the committee's cladding crisis and its impact on Londoners report? Is that agreed?
Agreed.
Can we ratify the signing of the letter from the all-party parliamentary group on leasehold and common hold reform to Right Honourable Robert Jenrick MP on the 8th of January 2021, following consultation with party group lead members? Is that agreed?
Agreed.
Thank you. So we now come to the main business of the morning. A question and answer session with the London Fire Commissioner and the Deputy Mayor for Fire and Resilience. Can I welcome our guests and thank them for joining us today? We have Dr Twycross, Deputy Mayor for Fire and Resilience, Andy Rowe, London Fire Commissioner, Matt Rack, General Secretary, Fire Brigades Union, and supporting the London Fire Commissioner, Sue Budden, Director of Corporate Services, Richard Mills, Deputy Commissioner, Tim Powell, Director of People, and Fiona Dolman, Director of Transformation. Perhaps I could start off the questioning by raising some operational matters, and perhaps we could go to you, Commissioner. What I'm particularly focusing on COVID, I should say. What impact has the new COVID-19 mutation and increased transmissibility had on the work the brigade is undertaking to support other emergency services during the pandemic?
Apologies, Chair, it was slightly muffled on my end. Could you repeat the question? I do apologise.
Yeah. What impact has the new COVID-19 mutation and increased transmissibility had on the work the brigade is doing to support other emergency services during the pandemic?
It hasn't affected our ability to reach in and support the other emergency services. We continue to have approximately 200 people seconded permanently to the London Ambulance Service, co-carrying ambulances. We continue to provide local community support, whether that's delivering medicines to the vulnerable or supporting local initiatives, anything from food banks to carrying out visits to those vulnerable in the community. We are exploring through the Strategic Coordination Group the possibility of us supporting vaccination centres. and possibly stepping into the space to support mass testing in respect of the new variants. Those are matters that are under discussion and underway inside the Strategic Coordinating Group currently. So my view is that the new variant, whilst obviously presenting a greater risk to the communities of London, hasn't affected our ability to reach in and support our partners as necessary.
Okay, thank you. In January, the Mayor declared a major incident in London. Has this affected your work with the ambulance service? And are more staff likely to be redeployed to co-crew ambulances and support PMART? And if so, for how long and what percentage of people?
So the declaration of the major incident obviously coincided with the sort of virulent spread of the virus through London's communities just prior to Christmas. The immediate effect that had is we went from having very low numbers at that point supporting the ambulance service. So at the height of the pandemic in the first wave, we had over 450 firefighters seconded across crewing ambulances. We had a request from the London Ambulance Service at the point of the major incident being declared to step those numbers back up radically again as their service came under pressure, and we remain at that level currently. Obviously that's under constant review, and as we see perhaps the vaccination programme begin to impact on the spread of the virus in London, I would anticipate those numbers coming down. At the moment, those numbers are maintained at about between 185 and 200 number in support of the ambulance service.
And are they taking off their normal shift rotas and doing it during the other 4 days, or are they actually taking their own time as it were in those 4 days? I think they're being paid on overtime, yeah?
No, they are seconded permanently across onto the ambulance shifts. So they've come out of our workforce, they're seconded permanently to the ambulance service, and their positions are backfilled by other firefighters working additional shifts, which the London Ambulance Service funds. So the cost of this is covered through the health budget rather than our own. So we maintain our cover and we provide suitably trained firefighters to support our colleagues in the pandemic.
Okay. Have the London Ambulance Service coughed up yet?
Sue, could you provide an update for me on that? But the answer, I think, is yes. But Sue, if you could perhaps provide the answer.
Okay, thank you.
Yeah, thanks, Commissioner. So the ambulance have paid up till September, and then we're finalising the details of shifts works from October to December, and then from January we've moved to a new, simpler cost recovery. But they are good for the money on this, so they are paying.
Okay, thanks. And they're paying the overtime costs, presumably, Sue?
Yeah, they pay the up to December. They pay the cost per shift worked with the allowances that the firefighters attract as part of that. And then the new, simpler way of doing it is that they just pay for the number of people that are seconded into them from January. Okay,
thanks. And this is a question for Matt, Andy and Fiona, I think. Should firefighters be on the priority list for the vaccine? Start with Matt.
Thanks, Chair. Yes, we wrote to ministers across the UK, including into Westminster in March of last year, saying that firefighters should be prioritised in terms of both any move towards wider scale testing and once a vaccine was identified. So that is our position. I think in terms of workplace safety, we would flag up some concerns that vaccination may not be a measure that guarantees workplace safety, because the vaccination, as currently understood, protects the individual vaccinated. It doesn't mean that that individual is not carrying the virus and cannot potentially spread the virus. So I think for us, in terms of control measures in relation to protecting the workplace, while firefighters should be vaccinated in our view, and I think in some cases are being related to vaccination work that they're undertaking, there would still need to be other control measures to protect others in the workplace and indeed the wider community and families at home.
Okay, thanks. Fiona.
Thank you, Chair. If I can just comment on the work of the brigade during the COVID pandemic as well, if I can take the opportunity to do that. I think it's right that we reflect on the outstanding letter the brigade received after the COVID inspection. and showed that the brigade stepped up in every single aspect of the COVID response. And I know that every single level of the organisation, from personal phone calls from the Commissioner to detailed help from the FBU and other unions, ensured that London really did step up. On the vaccination, we're clear, as you know, I'm involved in the strategic coordinating group, and we're clear, and this is the Mayor's view as well, that once we've got through phase 1 of the vaccination programme, it's important that the JCVI re-examines prioritisation from then on, and that should be on the basis of risk. And I think that the Mayor's made it clear that he does support this consideration of frontline workers once we got through the first priority cohort. We support the principle of the JCVI in terms of the risk to life and the protection of life that the prioritisation list it stands supports.
Okay, thanks. Well, it was good to see the inspectorate letter, as you say. Good to get a good letter from the inspectorate for once, I think. Andy, do you want to comment on whether people should have the vaccination?
I'm in the same position really as the Deputy Mayor, which is that we've got to be guided by the science and by the current guidance issued by the Joint Committee for Vaccinations. So my view is that the earliest opportunity, when it is appropriate to do so, following that guidance, we should be vaccinating firefighters because of their, day-to-day contact within the community and the risk that poses to them. But we would want to be guided in the context of when that prioritisation should occur by the science, because I'm very aware that the most vulnerable groups are prioritised currently because of the fact that the vaccination will, frankly, reduce the death rate in those most vulnerable groups. So I want to be guided by that, whilst ensuring that firefighters have the first opportunity to be vaccinated when appropriate. So I think the same position really as Fiona, working in the SCG, which is listening to the guidance and progressing it in that manner. I think actually, to Matt's point, I have heard from a colleague in health today to be in contact that actually there is some positive evidence around the possibility that the Oxford vaccine does provide some protection around transmitting the virus, but that is to be confirmed and is emerging. So that may provide some reassurance in the future when that perhaps does become more evidentially kind of validated. Thank you, Chair.
Yeah, well, that was on the news this morning, so I'm not sure it's been fully scrutinised as yet. But Fiona, what representations have you made to the government about this, if any?
The Mayor's made representations to the government about this. And has had regular meetings with the vaccine minister, both about this and about other aspects of the vaccine. And clearly, those firefighters that are working on the ambulance driving assistance are eligible for the vaccine in the same way that healthcare workers are as well, which is very welcome.
Okay, thanks. Andy, what impact has the lockdown had on staffing levels with the increase in infection rates? Andy, did you get that?
Apologies, I was on mute, Chair. So, Tim, could you provide the most up-to-date figures we have around levels of self-isolation, sickness and the impact on staffing, please? That's my Director of People, Tim Powell. Thank you.
Of course I can. Thanks, Commissioner, and thanks, Chair. Yes. So our workforce resilience has been pretty good all through the pandemic, actually. We've seen much lower levels of sick absence compared with other partner organisations. As of midday yesterday, we had 106 members of staff off sick with confirmed COVID. That's a reduction from 200 members of staff 3 weeks ago. And we currently have 201 members of staff in self-isolation for various reasons. That's a reduction down from 600 3 weeks ago. So we can continue to see good levels compared with others in relation to staff resilience around this. And the HMIC FRS letter that the Deputy Mayor referenced earlier was also quick to reference how quick we've been to respond in relation to the wellbeing of our staff.
So, Tim, presumably that's both FRS and control and operational?
That's all staff, yes.
Yeah, so what's the operational numbers?
So for operational staff, based on the numbers, 106, we currently have 75 operational members of staff who are off sick. There are 5 in control and the rest are all FRS staff.
And isolating?
Self-isolation, I haven't got the breakdown, but it would be similar amounts. The vast majority of them will always be operational, a smaller number in FRS and a very small number in control, because that's where the workforce, where the workforce numbers are split up into. So
If we add all that lot together with the operational vacancies at the moment, which is around 100, we've got getting on for 400 operational staff not available for work, never mind those who are on the London Ambulance because they're backfilled. Andy, what sort of impact is that having on your operational abilities?
Again, I'm going to pass that question to answer to Richard, but we're not seeing any drop at a London-wide level. We're not seeing any drop in attendance times. We continue to meet and improve our attendance times actually over the course of the year. So at a basic service level, we are not seeing a drop in response. Richard, do you have anything to add to that?
Yeah, certainly. So the response times as it currently stands, obviously our statutory requirement on 6 and 8, approximately about 5 minutes for our first appliance and 6 minutes for our second appliance. We have a requirement of 90% rate of below 10 minutes, and we're hitting that at 97% at the moment. In relation to appliances being available, we operate on a flexible delivery model insofar as there will be days where we are moving people around either before shift or during shift to make sure that you have sufficient operational cover per handler.
Yeah, okay. I mean, it does seem to be quite a high proportion of people hors de combat, as it were. If we've got the best part of 400 out of, what's the total operational number? Just under 4,500? Tim?
It's 4,700
Yeah.
operating staff in total, Chair.
So we're getting on for 10% being off for one reason or another.
Yes, just under, Chair, but again, that's comparable to levels we've seen throughout the pandemic, and we've managed to maintain our statutory response throughout. We've continued to deliver across all high-risk areas of prevention and protection as well. So whilst inevitably the pandemic has had an impact, I'm confident we continue to provide a level of service that London and Londoners need in the middle of this, as well as obviously, of course, stepping forward to assist in other areas in direct relation to the pandemic.
Right, well, I was going to go on to a couple of other areas as well, which is audit and inspection. Are you able to maintain the level of audits and inspections? Maybe that's one for Richard.
Again, if it's okay, Chair, I'm going to hand that to Richard because, again, the answer is yes, particularly focused on the highest risk areas, but Richard will be able to give you the detail.
Yeah, certainly. So we have, in line with the last PrEP conversation we have prioritised our audits and inspections, particularly around high-rise and high-risk premises, focusing on those areas where we have waiting watches and where the statement policy no longer stands. We have changed the way in which we are doing our home fire safety visit inspections, prioritising the high-risk visits first, because obviously we're mindful about the pandemic. And as of this week, we are introducing a computer-based app that's available to the public where they can carry out their own home fire safety visit. And then they can look at how they can then change their behaviours within their home. Part of that app is to allow people to identify themselves as high risk and therefore prioritise for face-to-face visit by us when it's appropriate to do so. We have had an impact through COVID about the level of home fire safety visits we've been able to do within Q2, but that is because it's been a conscious effort by us not to go into low areas in the community that may not want us at this time, obviously being involved during the lockdown period.
I was going to go on and ask you about the virtual home fire safety visits. So you're saying that the app's up and running. How do people get to know about it?
So the app is being launched this week, so there will be communication both internally and externally. It'll be available on our external website. I can make those contact details available to you. And when it's being launched, obviously there'll be some media that we'll encourage to go out through partners to encourage people to use it.
Okay, thanks. Assembly Member Hall wants to come in. Susan.
I did. Thank you very much indeed. Going back to the assistance with the ambulance service, can I ask? I suppose I should be asking Matt Rapp really. Have the union supported firefighters who have worked with the London Ambulance Service?
Do you want me to answer that, Chair?
Yeah,
It's not Paul Embry anymore I speak to, is it? It's you from the national.
Well, Paul Embry's never been in my position, actually. I don't know what Paul Embry. Paul Embry's working for you somewhere, I believe.
No, he's just written a very good book called Despised. But anyway, do you support your London Ambulance Service colleagues?
We have supported initiatives to support the response to COVID since the start of the pandemic. We've raised that at a national level from the start. And have, I think we were very pleased with the agreements that we put in place, firstly in a tripartite agreement with the National Fire Chiefs Council and the fire service employers. I think the advantage, and then subsequently in the autumn of last year through the National Joint Council, I think the advantage of that is that it built into the COVID response the importance of risk assessment and an agreement by all parties that risk assessment and the necessary control measures needed to be built into that, but also I think protected people's terms and conditions. So it was agreed by all parties that this work was not part of core work, and therefore it was a voluntary arrangement was introduced to allow people to volunteer on that basis, from which they could withdraw, because everybody's in different circumstances. People might have different situations at home, different levels of concern, their own health position and so on. So I think the agreements which we reached, we were very pleased with. I think that gave confidence to union representatives at local level, including within London, and then down to individual firefighters wishing to volunteer. I think the London officials, and they wanted me to make this very clear, that actually without that national agreement you would not have got that level of cooperation within London. I know that the EC members made that view very clear to the Commissioner in the last couple of days. Regrettably, there are some differences now have emerged, not necessarily with the operational leads in London, but elsewhere, regarding the testing of firefighters and the safety measures put in when people return from the secondments working for, in your case, the London Ambulance Service, for example, and back into fire stations. And that has unfortunately caused some difficulties, which we are working to try and resolve, and you know, Fiona, who sits on the National Joint Council, will be aware of our attempts to resolve that as we speak.
But as far,
so yes, we have supported that work.
As far as London's concerned, Matt, things are all right. As far as London is concerned, we're all right.
Well, I think what is unclear to me from the Commissioner, and maybe Commissioner and Fiona may wish to comment on that, is that it is clearly preferable, in our view, that there is a national agreement. That is what gave confidence to firefighters, including London firefighters. That's very clearly the position of the London Regional Committee of the Union. They want to see a return to a national agreement, and we would want to see the London Fire Brigade supporting that move to return to a national agreement as quickly as possible.
I think Fiona wanted to come in. I think Fiona wanted to come in, I think. Susan.
Yeah, I was just going to say that regionally we've got really good relations, and I referred to the relationship with the FBU as being quite important in terms of the COVID response in London and getting things up and running earlier than many other parts of the country and on a much wider range of activities. So I think Matt's right that the tripartite agreements have been important in enabling fire and rescue services to engage in that full range of activities in support of the response. I've personally engaged with the chair of the National Joint Council to do whatever he can to get the talks up and running again. And as Matt refers to, I'm sure that the FBU wants the same and really hope that the talks can restart as soon as possible and get that back up and running. Thank you, Chair.
Okay, thank you, Fiona.
So basically the answer is yes, and there are no issues with our firefighters going to work on ambulances. Well, I'm very pleased about that. I'm sorry if there are any issues that are coming up now, because it's worked very well, and we do have a very good relationship with the unions in London, that's for sure. Okay, I'll leave it at that. Thank you, Chairman.
Okay, thank you, Susan. We're now on to the second section, which is Alison Moore, Assembly Member, on the new legislation going through. Alison.
Thank you very much, Chair. And this first question is for the Commissioner, if I may, Andy. What impact will the new fire safety and building safety bills have on the work of the brigade?
So that's quite a complex question, actually, because obviously some of the detail within both parts of legislation is still to emerge. Obviously, the building safety bill, we're still in the consultation phase. I think the point to draw the committee's attention to is the scale of the issue in London. So London's built environment is itself very complex. So whatever legislation is in place needs to be an enabler for the fire service rather than something that can't be pragmatically delivered. And obviously we have a team of people actually working in partnership with colleagues in central government and across the national fire sector, talking to colleagues in the union actually as well, about how that is best practically achieved and feeding that information into the passage of the legislation through Parliament. I think to give it a context, within London, MHCLG have identified in excess of 62,000 premises currently, and that number's growing, that they consider may fall within higher risk categories, that they may consider designating as being within the scope of the new building safety regulator. That includes care homes, sheltered housing blocks, hospitals where the vulnerability of the residents is a crucial factor. We've been notified of 8,005 high-rise premises by MHCLG's Building Risk Review Programme, which comprises nearly three-quarters of all the high-rises in the UK. And actually we have 625 buildings at all heights in London currently listed as having been changed from a stay put to a simultaneous evacuation strategy because of issues with its fabric. So I think the answer is it's going to have a considerable impact on our business, as it were. We anticipate us increasing the level of protection activity greatly. We have brought forward a training programme which ensures actually that frontline firefighters are going to deliver more of the protection activity. So we anticipate, up to about 30,000 additional fire safety audits a year carried out by frontline crews who have been provided the appropriate skills training to do so, and then enable our professional inspecting officers to focus on those most high-risk premises. But in very simple terms for the public who might be watching this to understand is the scope of what we're facing in London is becoming clearer. I think what I've seen from the second phase of the Grenfell inquiry is shocking and hugely disappointing. We are working hard on a daily basis with all the relevant stakeholders to properly inform and then help with the implementation of the legislation, and that will result in a greater workload for the fire service in London because it will need to help do its part to mitigate that risk as it emerges on a scale that perhaps we hadn't previously understood. Does that provide you enough of an answer, Assembly Member?
I'll follow up with two. You've talked a bit about the sort of challenges that's going to present. Are there any other main challenges for the brigade that you see that creating, and how will you manage the expected additional workloads, in particular considering current stresses such as the recruitment freeze and the pandemic?
I think we're going to address the way we do meet that risk through the community risk management plan. So what we would call the London Safety Plan. There will be a fundamental part of our planning process in terms of how we adjust to what I think is a different understanding about our operating environment in London, this greatly increased risk profile on the basis of what we've seen out of the inquiry. And we will think about how we balance the firefighters' day. They're busy people in London anyway, and we will be thinking about how we make best use of our resources and those skills that we have within the workforce to deliver that work. But it will obviously come at a cost. both in terms of training, in terms of their time, in terms of the scale of the issue that we are going to have to be part of mitigating. And we're considering all of those issues very carefully. Obviously, we're in the early stages of that community risk management planning process, but that is where those details will emerge.
So it's putting quite considerable pressure and a change in pressure on the service. I mean, have you any detail about the level of financial support you would expect, and where this is going and whether this is going to be sufficient to cover the increased numbers of inspections and the knock-on to other tasks?
I think that's a good question. So what I would say is that I think the government is serious about funding this. So setting politics aside, I think the government is serious, and we are working closely with central government and obviously the Mayor in London to talk about the cost of this, to build it into future budget projections as we begin to see the emerging scale of it. You know, that's not clearly defined yet. But I mean, just to give you an indication of the funding we've already received, which perhaps speaks to the scale of it in London. In July, we were awarded a Home Office grant funding for 2.3 million for the Building Risk Review programme, 3.2 million for the Protection Uplift programme, giving us a total of 5.5. And we would like to see this funding repeated or consolidated to help ensure that we can meet the demands of the existing built environment that are expected to exist over at least the next 10 years, and I would say at least the next 10 years. So I think, you know, useful early funding from the Home Office, but that needs to be baselined and consolidated for us to continue to provide that level of service for London and Londoners.
I mean, what would be the specific impacts of the increasing the workload of the brigade, as you've talked about, without providing that additional longer-term funding necessary to support the work? And are there any areas of the LFB's work that you would have to consider reducing as a result if you were not to get funding?
I don't think I could give you an answer now, because I think what we've got to do is enter the community risk management plan process in a really straightforward and transparent way through good consultation with communities, with all the stakeholders, you know, some of whom are on this scrutiny meeting, and with our own workforce to really understand where that pressure is going to lie, because it's a complex area. So rather than give you an answer now, which might be incorrect, actually that bit of work, that bit of planning has got to be done on the basis of evidence, taking into account the data available to us, the emerging data, a really kind of careful analysis of what it means in terms of increased workload and therefore the cost associated with it. And that will have to emerge through the community risk management plan process, and will be the work of many people inside the London Fire Brigade to frame. So it would be wrong to kind of give an answer off the cuff. This is a complex area that will require detailed planning, will emerge and will obviously be scrutinised rightly by this committee as that detail does emerge.
Yeah, thank you very much for that, Commissioner. And I realise that I should have obviously given the Deputy Mayor, Fiona, an opportunity to comment on both those last two questions. So if you would, if you've got anything to add to that, I'd be very pleased to hear it.
I think the main point I'd like to comment on is the need for more funding on this from government. I mean, it's really welcome that we've got the £5.5 million for fire protection that the Commissioner mentioned, but as a one-off for something that's going to be an ongoing piece of work, we would like to see this continued and extended and addressed properly by government. The Commissioner highlighted the specific issues for London in this. We carry a huge amount of the risk. This is likely to have big implications for the workload of the London Fire Brigade and individuals within the Fire Brigade, and it's just important we get that on a secure and stable footing. So we're keen to continue to talk to government about how we can do that, and look to find ways of ensuring that we continue this work without cutting other vital work that the brigade does on a day-to-day basis.
Thank you very much. I mean, the size of this challenge is quite you know, it's even now, it's still, the detail of that is still unfolding. So I'm sure it's something that the committee will return to repeatedly over the coming years. But absolutely hear what you say.
Could I make a comment on that?
Yeah, Matt. Yeah, go ahead.
Mate. I think it's a very good question, and It's one that we've raised in relation to the Grenfell Tower inquiry ourselves, and in relation to both pieces of legislation. The fire service, including in London, is operating today with considerably fewer resources than it had a decade ago. Unprecedented level of reduction in staffing. It never happened before in history. The Grenfell Tower inquiry has exposed the scale of the building safety crisis that we have in this country, and frankly the level of complacency at all levels, I have to say regrettably within the fire service as well, that have emerged over the past 20 years or so, where we have and I think the figures that the Commissioner gave in terms of the buildings identified in London so far. So clearly there are huge staffing implications. We have, as the Commissioner rightly says, if we want people to inspect buildings professionally, then they need the adequate training. There are only so many hours in a day, and there are only so many people on a fire station. So I think this very clearly makes the case, and I would hope there is a joined up approach to central government, that actually what is needed is long term. If we are serious about building safety in the UK, then we need long term investment, including in the fire service, to make sure that that's delivered in a robust way, safely, and in a sustainable way, and that requires investment in our view.
Yeah, thank you, David. Thank you for that comment. Chair, if I may pass back to you, and thank you all three of you for your responses.
Yeah, well, thanks for that as well, Matt. I think it's important to recognise that the fire service is a respected organisation for when it comes to doing inspections, in a way that sometimes some of the privatised companies may not have the same authority. So it is important that this is properly funded to enable the safety to be done. And as the Commissioner has said, it's not just a question of cladding, there's all sorts of other things that are wrong as well that need to be attended to. So can we go on and look at Brigade Finance, and Assemblymember Arbour is going to lead off on this.
Commissioner, before I ask you specific questions, I can ask you a question on budgeting strategy. Has the budget been based on historical assumptions, or has it been based on objectives set out in the London Safety Plan?
Clearly, our budget is. Apologies. Can you hear me? Yeah, sorry, my mute wasn't working. I'm going to ask Sue to explain how we use both past and future projected data to consider our budget. But obviously, we gather information all across the brigade around what we think we need to budget for in the context of planned projects, where we see it going in the future, as well as taking into account historical data to ensure we maintain the response levels that London and Londoners need. But Sue, perhaps you could offer some detail.
Well, I think just in answer to the specific question, so it's based on the current London Safety Plan, which we know runs till April 22. And we've done our budget for next year on that basis. And then, as we've said in the answer to the previous question, work is underway now for what will be the next community risk management plan that will inform the budget from 22-23 on.
Does that mean that you didn't agree with HMI, who said that your budgeting was based on historical assumptions rather than on the plan?
I think the challenge that the HMI placed for us was how we use our resources, as I understand it, rather than the size of the budget. And I think that's a fair challenge, actually. I think, particularly in the context of the question we just had from Assembly Member Moore, we need to think very carefully about how we use our resources in London to face what is a significantly, from my perspective as a professional firefighter, higher risk environment. And actually, in responding to that point made by the HMI, it's our intent to run a transparent, well-evidenced community risk management plan process that ensures we have the resources in the right place to meet those risks, and taking into account any additional burdens that risk environment might place upon us.
All right. Well, thank you for that, Commissioner. Well, of course, my successors will hold you to that one. If I can ask you again, Commissioner, specifically, given the fact that there is a major incident in London in relation to the pandemic, what sort of long-term commitment have you got for an overtime requirement?
Andrew, can Alison come in, C&D?
Sorry, Assembly Member, are you asking what I think the...
I'm asking you whether or not taken into account the extra overtime, which is clearly going to be needed so long as the major incident lasts. I want to ask how you've budgeted for this additional overtime.
So I think there's two separate pieces to this. The first really refers back to previous answers, which is the overtime required to backfill those personnel supporting the London Ambulance Service. For example, and we've done it for other agencies in London, is paid for by those agencies. So it doesn't represent a cost to our budget, and that is clearly set out in the kind of budget papers we've submitted. Richard, perhaps you could talk to our work around pre-arranged overtime. It may fall between yourself and obviously Tim, our Director of People. So perhaps you could start, Richard, and explain.
Well, before you pass over to Mr. Mills on that one, I wonder if you are ignoring the fact that if it matters not whether it's voluntary or otherwise, the commitment that your existing staff are making to the current situation, clearly if more people are involved in this, the likelihood is that you are going to need additional staff to fill the gaps which are going to be left because staff are using their own time to work on the emergency.
Yeah, and I think the answer again is that if we are backfilling staff through overtime to support the pandemic directly, those costs are being met by the agency involved, so it doesn't impact the budget of the London Fire Brigade. So you're absolutely right, it's an extraordinary time. We are providing a lot of additional support into other agencies in London, particularly health and the London Ambulance Service, but those costs are met through health. So we are planning on the basis that those costs are recovered and do not impact the budget overall.
Okay.
Thank you.
I wonder if also you could comment, please, on the recruitment freeze and whether or not that's likely to affect the GLA family requirement and indeed your own requirement to have a more diverse workforce.
Yeah, that's a good question, Assembly Member. It will, and that is one of my great concerns around being in a position where we pragmatically need to consider a recruitment freeze to give ourselves the space to plan moving forward in the context of the budget that is projected. So yes, that is a real concern. We're thinking about how we might mitigate that, but really there is no answer other than to say yes, it will inevitably have an impact, because we've had 2 years where we've been immensely successful in recruiting a far better representation of London into the workforce, and obviously at the point we freeze recruitment, that will be impacted. That is of a concern to me. Yes.
All right. Thank you very much. And finally, I'd like to ask you about other sources of finance, particularly in relation to the property portfolio and perhaps additional sponsorship. Are you working on creating additional income in this way?
Sue, can I pass to you? Sue?
Okay, Sue?
Yes, so in terms of income from property sales, there are obviously two at the moment. So there's the disposal of 8 Albert Embankment, which was subject to the planning inquiry in the run-up to Christmas, and now we await the Secretary of State's decision on the outcome of that. And if we're successful with that, then obviously we've got a development agreement in place that would see capital receipts come from that. We're also in the process of putting in a pre-planning application for the sale of the Clerkenwell Fire Station on the open market, following Islington's decision not to proceed with their purchase, which I understand was linked to their experience of the financial impact of COVID. So they're the two more significant opportunities we've got around property. In terms of sponsorship, we're in the process of looking again at our sponsorship policy, mainly in relation to the future of the museum, which goes back to the 8 Albert embankment development and the opportunity to have the museum there. And the Heritage Lottery money that we've got is linked to an expectation that we will be able to raise money to support the museum, both in its creation and its ongoing running. So we're looking at a sponsorship policy around that.
Okay, thank you very much. Thank you, Chairman.
Okay, Assembly Member Moore wish to come in.
Yes, just a couple of issues around funding to pick up. I mean, there are a couple of key issues, and this one's maybe a bit of a vexed one, but how does the uncertainty caused by the government's unwillingness to commit to longer-term funding of the LFB pensions impact upon the resilience of London Fire Brigade's budget? And that's to the Commissioner.
Thank you, Assembly Member. I'm gonna pass to Sue, because I know that we've had some movement on that, and she'll be able to give you the detail and the metrics as well. So if you could pass to Sue Budden, my Director of Corporate Services. Thank you.
Yeah, certainly. So the government have once again repeated the £21.7 million grant as part of the settlement for next year, and our understanding now in conversation with the Home Office is that this will form part of the base funding for the fire service going forward. So that will pick up the costs of the 2016 valuation of the firefighter pension scheme. So we think that is now covered going forward, notwithstanding what they might do to the overall funding position.
Okay, that's helpful, thank you. And then two other issues. One, looking slightly wider. Comparisons with other global cities show that you receive significantly less funding per head than perhaps examples like Paris or New York. Does that have an impact on the work the brigade is able to do? And looking more locally, how does the workload of the LFB compare with that of other fire and rescue services?
So we're the busiest fire and rescue service in the UK, the busiest in Europe, and one of the busiest in the world.
Hang on a minute, Alison, when you ask about comparators, you're asking about international comparators or UK comparators?
International.
I actually asked the two, and perhaps I shouldn't have conflated the two. There is the international comparator where we're getting significantly less per head than, for example, Paris or New York. But there is also subsequently a comparison to be done with the other fire and rescue services. So maybe can I withdraw the second half and let you do the international one first, and then I'll re-ask the second part.
It's fine, Assembly Member. It's a good question, and I can answer both parts. So we'll start with the international comparisons. We just completed a detailed bit of work as part of the initial stages of the Community Risk Management Plan, because we think sometimes the comparators with other fire and rescue services in the UK don't really reflect the difference of operating in London, because obviously London represents a very serious proportion of the country's GDP. It is the centre of government, it is the centre of finance, it holds much of the critical national infrastructure of the country. It is still ranked #1 in the global city comparator rating, so it's still rated as the kind of most complex global city environment, encompassing all those kind of functions. So when we've discussed this with colleagues in central government who are extremely interested in that comparison, we've made the point that we are relatively lean in comparison to almost every other fire service serving a city comparable to London per head of population, and that report will form part of the planning and the kind of risk analysis around resourcing and how we mitigate obviously what's now emerging as an even more significant risk. We've really understood it in London as part of the CRMP process. So we think it's useful to compare ourselves to other international cities of a similar kind, because we haven't got anything the same in the UK to compare ourselves with. But we know that that's got to be done in an objective way, based on good evidence. And Fiona Dolman, who is our Director of Transformation on the call, has led a piece of work to do that, resulting in a report that's internal at the moment, but will soon form part of that planning process and will be released as part of the kind of information that informs our planning. In terms of the local comparators, it's very hard to compare us to anyone else in the country. If we look at Manchester, which is the next biggest conurbation, they have under a third of the population. Their brigade, their fire service is under a quarter of our size. They have 500 high-rises in Manchester. They're the next, so to give you a simple comparator that people would understand, they have 500 high-rise buildings in Manchester, the next biggest conurbation in the country. We have, that we know about, 8,005. You know, it's just a different scale and a different level of complexity in terms of the risk, the function, and that's not to be disparaging to colleagues in the rest of the country who do a fantastic job, you know, and will be facing different risks and different issues and different challenges. But there is something about London that we need to kind of consider in the context of other global cities and what you need to do to provide a fire service in a city of this type.
And an increasingly complex environment. I don't know whether the Deputy Mayor has anything to add to that.
I think that it's tempting to make international comparisons on finance, and one of the things I think we should do with international comparisons is to look at what we can learn in terms of fire safety as well. So I think that as you'll be aware, Assembly Member, the Mayor's doing everything he can to protect the London Fire Brigade from the inevitable spending reductions being imposed on London following COVID. And in order to minimise the impact on frontline services, the Mayor's made the smallest percentage reductions in funding to the police and fire service. So we do look at international comparisons, but it's sometimes not an equal, sort of equivalent comparison. I would argue that actually the international comparisons you've made demonstrate what good value for money the London Fire Service is, and I'll work with the Mayor and with others and continue to lobby government on making sure we get good sustainable funding for the many challenges that some of which have been outlined already that London Fire Brigade and other fire brigades around the country are facing. Thank you.
Thank you, that's very helpful. You know, many challenges and enabling you to rise to those. I'll pass back to you, Chair. Thank you very much for allowing me the intervention.
Thanks, Alison. I've got some of the figures here. If we compare London and New York, the easiest ones to do because they're both comparable cities in terms of population size. London gets £43.74 per head, and New York gets £182.08 per head. So, getting on, well, more than 4 times as much. So, there's some big differences there. So moving on to our next set of questions. This is from Susan Hall on emerging fire risks. Susan.
Okay, thank you. Can I ask, Commissioner, what are the main emerging fire risks and what pressures are these adding to the brigade?
If I might, I would like to pass to Richard Mills, my Director of Operations, because he has responsibility, along with colleagues in other departments, for mapping that risk and then making sure our response meets it. And I think it would be helpful for him to provide that detail, if that's okay, Assembly Member. Richard, would you mind?
Thank you, Commissioner. So I think the emerging fire risks that we're identifying is a topic of conversation that's been had pretty much at every threat. It's about the poor built environment. What we're beginning to see and learn from phase 2 of the inquiry around the construction industry, and obviously the drive for the fire safety bill and for the building safety bill. What we are looking at and working with government very closely is about how we shape both those bills to meet the needs of the National Fire Service and the London Fire Brigade, and also working with colleagues in the NFCC in preparation for how we then deliver those services when those bills actually come into force. There's going to be supplementary bills as well, secondary bills that will be passed that will then inform how we do our approach going forward in dealing with those emerging risks. One of the things that we are identifying is that from planning to designing to building and then building enforcement and regulation is where some of those challenges are lying. So we recognise that we are working within a failing built environment. We're recognising that legacy will be there for some time. So we are training and equipping our firefighters, like the high-rise training that we're doing, to identify when a building is catastrophically failing and to put measures in place to rescue as many people as we can. So in answer to your question, Assembly Member, it is about the built environment that is our biggest challenge. It will be emerging risk for some time.
Okay, I understand that. And does the London Fire Brigade have capacity to deal with these emerging risks?
I think I should probably answer that, Assembly Member Hall. I think the answer will lie in the community risk management plan, and I think genuinely we have to plan very carefully in the context of the risk is emerging, because I'm not sure that that's an answer I can provide at this point because of the scale of what we're facing and the emerging detail, particularly from the inquiry. I mean, I think the attitude of developers in the construction industry in particular has, it's appalled me to watch the inquiry and hear what I've heard about the standards of construction. There's a great focus on cladding, but actually cladding is not the only issue. There is a much broader issue around risk that fire services face, which is around the standard of construction, the negligent use of subcontractors with no control through the building inspection process, and what that means in terms of compartmentation, the potential spread of fire through the use of the wrong kinds of materials is a far larger issue than cladding. So whilst it's very important that we, remove the cladding from dangerous buildings, it's very important that that crisis is addressed and we provide some relief for leaseholders, for example. Actually, I would not want this to become a story just about cladding. It's a much more serious issue that is emerging as the details from the inquiry are delivered, and as we see perhaps some of the practices within the development industry particularly. And that really is the risk we have to speak to, and that is far larger than anyone had previously considered, and will undoubtedly have an impact on our kind of resourcing and the way we tackle it. And I think we need to plan very carefully in the context of that emerging evidence. So, for example, it was only in the last 2 to 3 months that we received the figure of 62,000 high-risk buildings in London, which I already mentioned. That number is likely to grow. We already had 800,000 buildings in London that fell within the scope of the original regulatory reform order. That number is going to grow exponentially under the new legislation, and we will have to think very carefully about how we service that demand to ensure we focus on the highest risk buildings, both in terms of our prevention and protection activity, but also the scale of the resources we need to send. So, for example, we've got an increased predetermined attendance now to high-rises, because we know that what we might encounter there could be far worse than we had previously understood. So therefore we have to send more resources to high-rise fires immediately to ensure we have a safe system of work to address it. And that again will need to be built into the planning around all sorts of other premises as this information emerges.
Okay, the London Fire Brigade has revised the policy PN 63. No, that's not gone live yet, but that would allow the incident commander under exceptional circumstances to commit crews with detection equipment. But when will that go live?
We're covering that later in the agenda.
Excuse
Susan.
me, Chair, I'm doing those questions. Thank you,
The
Chair.
only, I was just saying that high-rise firefighting comes later in the agenda, so I was on that.
Okay, well, I'll come back in on that time. Will you have completed all the Grenfell Tower Inquiry Phase 1 recommendations that are exclusively directed at the London Fire Brigade by March?
I'm going to pass to my colleague, the Director of Transformation, who's responsible for ensuring the Brigade delivers against the recommendations. But as previously stated to committees before, it's our intention to deliver against the recommendations. We agree with them. We are doing that at the earliest opportunity, taking into account the very difficult operating circumstances this year. But Fiona Dolman, my Director of Transformation, will be able to provide you with the detail of when we will deliver against those recommendations. So, Fiona?
Thank you. Thank you, Assembly Member. In terms of the Grenfell Tower Enquiry recommendations, for next financial year, there is one remaining action that's directed specifically at the London Fire Brigade. That's GT26, and that relates to improved communications, and it's scheduled to be fully addressed by May 2022. And that's around the implementation of new breathing apparatus sets and new radio interface equipment.
Okay, that's quite a time away.
Yeah, in the context of the other recommendations, Assembly Member, by the end of March 2021, a further 17 inquiry recommendations applicable to the brigade are due to be completed. They're on track. At the end of March, 15 recommendations directed to the LFB or fire or rescue services will be addressed, along with one directed to building owners that has a knock-on impact for LFB, and one directed to the LAS and MPS, which also has a bearing on our ability to respond.
Okay, fine. Thank you very much.
Thank you, Assembly Member.
Okay. The next set of questions is on specialist staff, and I'm going to take these. Can you give us an update on the Command Unit Integration Project, please?
Thank you, Chair. I'm going to pass to my Director of Operations, Richard Mills, because he's responsible for delivering that project in partnership with some of the other teams in the other directorates. So, Richard, please, could you provide an answer?
Yep, certainly. So, the Command Unit Integration Project is progressing well. We're on target to implement of all command units, and the last move is going to Merton Control. So we're on target to do that by the delivery time of March. We have a programme in place to upskill the stations staff where these new command units have gone to, or the existing command units have gone to. And we are also in the process of looking about a redesign within our control centre at Merton, which is where the additional command unit is going, to enable command unit staff to not only train with our control colleagues, but also to have in effect a command suite there where they can practice some of the work that we do, not only on fire stations with officers and firefighters, but also with control staff. So we're on target to deliver it. We are still delivering the training, and we have, in conjunction with colleagues from People Services, recently in the process of running a promotion round for leading firefighters, which will enable us to fully staff those command units once that selection process has been delivered.
Okay, thanks. When I was visiting Control some time ago, they were saying that they're going to try and organise for a control officer to go on the command units at major incidents. Is that going to happen?
So we're working towards it. Part of that is about getting a command unit positioned at Merton and allowing command unit staff from fire stations to do a rotation into control. That is about the interface between control operators, command unit staff, and having a training facility there for officers from fire stations and senior officers to go there and have a bit of a command suite there to practice some of those skills. The long-term aspiration is to integrate command unit staff much, much closer with the front line. So it is an aspiration we're working towards, and the first step you'll see in the coming months as we introduce that command unit into control.
Okay, and can I ask you about fire rescue units, FRUs? What's the current staffing levels in FRUs?
I don't have the level of detail to hand, but I can certainly provide that to you afterwards around the staffing levels.
Okay, I mean, one of the issues that came up when visiting fire stations is that, in relation to FRUs and also to command units, I guess, is that there was a reluctance of people to do the training and go onto the specialist units because they felt they were going to get stuck in their careers because there weren't enough staff to do it, so they couldn't be moved on because there's no one to backfill when they moved on into promotion or other roles. How are you addressing that, and how far have you got with that?
So there's some work that we're undertaking internally at the moment to look about some of our business intelligence systems and how they can interact with each other to identify how we do a promotion round and how we allocate our skills, not only along FRUs, but in a much broader sense. There's a paper that's coming to my board, which will then find its way to the Commissioner's board with a number of proposals about how I think we can deliver that more effectively. we absolutely recognise that there are many motivated people that take these skills on for their own professional development, and we're keen to ensure that we provide them the opportunities to not only take those skills on, but move on within the organisation when it's appropriate to do so. We are working with People Services and our training colleagues to identify the best means of doing that without affecting our business delivery.
So how long is it going to take to get some progress on this?
So I'm hoping that I will have the papers coming through my board within the next month, which will then see its way to CB in subsequent months. Subject to the Commission's decision about how best to resource it, then we'll introduce some systems that will enable us to have much more closer business intelligence. And then at that point, it will be about how we allocate training courses going forward. It would be appropriate for me to preempt any decision that may or may not be made at Commissioner Board level. And also, I wouldn't want to give any false hope in the short term, but just to provide assurance to yourself that we are trying to develop systems that mean that we deliver training in a much more effective way.
Okay. Matt, I don't know if you want to comment on this from the union perspective. Have we lost it?
No, not particularly, Chair, thanks.
Okay. Right, so we'll move on to the next section then, which is property, and I think that's David Curtin. David.
Yeah, thank you, Chair. Good morning, everybody. If I could ask Commissioner Rowe some questions about property. First of all, to do with the Croydon Training Centre, because that was originally due to open in September 2019, but now the date has been put back to July 2022. So can you give us an update on the Croydon Training Centre about when you think it might go ahead and be finished, and what the impact will be on the delivery of training?
Thanks, Assembly Member. If I might, I'm going to pass to Tim Powell, my Director of People, which is responsible for that project, and will be able to provide you with a detailed update. So, Tim, please. Thank you.
Yes, thank you, Commissioner. So we're currently reviewing the Croydon Training Centre. We go back to 2015, and the Croydon Training Centre was originally put in place to enhance and future-proof us having our own facility. Since 2015, the high-rise training requirement has changed, and new learning objectives have been introduced around an urban firefighting and rescue training course, which will require facilities that can't be provided in London. Therefore, the Croydon training facility won't be able to provide the facilities for all elements of the course. On that basis, we've kind of just held the project at the moment, and we're reviewing the feasibility of continuing with it. No decision has been made, but we are conscious of both in terms of the budgetary constraints that we're going to see going forward, whether we want to continue to invest in a piece of property that won't do what it was originally envisaged it was going to do. So no decision has been made, but we are currently reviewing what we do in relation to the Croydon Training Centre.
Okay, thank you. Have you identified any possible sites outside London you say you might need to provide for the needs that you have for training?
Yeah, so we've looked at other areas. That there are places such as our Fire Service College, Greater Manchester, West Midlands, Bedfordshire, and Northampton. All have venues that might be that might be able to do what we need them to do. There's obviously the issue about how we would get people there and so forth, but we're continuing to review where we might be able to provide the urban firefighter training going forward.
Okay, thank you. My next question, I'm not sure who is the right person to answer this, is about 8 Albert Embankment. So can anyone give me an update on the latest position regarding its redevelopment and what's happening with the public inquiry on 8 Albert Embankment?
Thanks, Assembly Member. I'm going to pass that to my colleague Sue Budden, the Director of Corporate Services, because, again, she has responsibility for that area of business. So, Sue, could you provide an update, please, to the committee?
Yes, of course. So the inquiry finished before Christmas, and now we just wait. So, as we understand it, the inspector feeds through his report and his recommendations through to the Secretary of State. We don't get to see those. And then the Secretary of State decides whether he's going to allow the development to proceed or not, and then at that point what the inspector found becomes public. But we haven't got a specific timetable for that. It could be March, it could be the summer.
Okay, thank you. there's no specific date on that one. But how about other assets that you want to sell off? You mentioned earlier Clerkenwell Fire Station, and there are others as well. So could someone tell me any updates on any other property assets that you plan to sell off, I suppose, to help the budget of the fire brigade?
So in addition to Clerkenwell, there's only 2 much smaller sites that have radio masts on them, and we're in the process of agreeing heads of terms for their sales, but they are in the sort of hundreds of thousands of pounds brackets rather than the millions. And once we get to the disposal of Clerkenwell, we'll have disposed all the sites from the station closure round we did under the 5th London Safety Plan. We haven't got any plans to sell any of our other properties at this point.
Okay, that's good. All right, well, thank you very much. Okay, back to you, Chair. Thank you.
So how much have we spent on security and maintenance at Albert Embankment, and how much on Clerkenwell since they were closed?
I'd have to write to you again on that one, so we answer this question quite a lot. We keep a running tally, but I can give you the latest figure, but I'll probably have to write to you then.
Yeah, well, I think that would be helpful, because it's certainly a lot. And the other question I was going to ask you, when does the lease on Union Street run out?
2027.
Okay, thanks. Okay, we now go on to high-rise firefighting, which is the last section we're going to ask about, and Assemblymember Cooper is going to lead off on this. Leonie.
Sorry, still muted, mistake. Thanks very much, Chair. Managed to re-mute myself or something there. I'd like to start with you, Commissioner, if I may. I'm picking up a bit of an echo. I don't know if someone's forgotten to go on to mute. Oh, thank you. And then I'm going to come to Matt Rack for several comments, if I might do that. And Commissioner, I wanted to start, we almost went there just now, but obviously we've got the new policy notes, and we've got the training. We're now just beginning of February, and last time when you came to talk to us, I think you were saying that you hope to complete all the training and then go live with the new policy notes from the end of March. And I wondered if you could just give us an update on the progress on the training, whether I know there's been delays because of social distancing and obviously the pandemic and things like that, but are we still in a position to go live at the end of March? How's it all going? And have you been trained yet?
I haven't, but my Deputy Commissioner Richard Mills has. I will be. And I'm going to let Richard give you the detail, because we progressed well with the training, but I'll allow Richard, who has responsibility for that area of business, to tell that story. Thank you.
Okay, thanks very much. Richard, how was the training? And also, when am I going to get to see the 64-metre ladder? Because obviously Wimbledon's in my constituency. I don't expect to be offered the opportunity to be trained on it or use it, of course.
On the last question, you're more than welcome. As and when we roll them out, I'll make sure there's an invite to you, and I'll give you the opportunity to ride in the cage, subject to the conditions and training. So you're more than welcome on that piece. And I can cover that later on, subsequently if need be. In relation to the high-rise training that's taken place, so yes, I have taken part in both the computer-based training that all operational staff have done, and I attended the guided learning exercise last Friday to observe that taking place for middle managers and senior officers. The computer-based training that took place the last time we had a conversation has gone well, and we've exceeded the 80% figure, which allowed us to progress to the in-house training or face-to-face training of junior officers up to station officer. And as of the start of this week, as I reported to the Mayor on Monday, we have 86% of junior officers that are trained. That training will run until the 12th of February, and we're anticipating we'll hit about the 92% mark at that point. The guided learning exercise for senior officers started in the middle part of January, and as of Monday they were at 81%, so exceeding the 80%, and we're predicted on the guided learning that by Friday the 5th, so that's this week, we're 91%. So we have exceeded those targets that we were aiming for. What I would say is that the overwhelming response that's come from both junior officers and middle managers and principal officers, because we do like a satisfaction rating at the end, that's been a rating about 90% on that feedback, and unanimously people have recognised the significant benefit of having face-to-face training delivered by their peers around a subject that is obviously very challenging, and to give the opportunity for people to discuss that. That is a real success story as we see it. Going on to fire stations, so the part of the training and the learning exercise is for the middle managers to then take that out to their stations and to deliver it to watches in conjunction with their junior officers that have received that training as well. So that is commencing next week. We have front-loaded the schedule, which will take us to the 21st of March, which gives us a 10-day leeway should we have any delays due to COVID or large-scale incidents. So on the delivery of training, I think the general feedback I'm getting, not only anecdotally but evidence-based, is that all officers and firefighters as a whole recognise that we are training in an unusual environment that we've never seen before. So we'll continue to monitor that going forward, and I monitor that on a weekly basis.
Okay, so thank you very much for that and your perspective about the response to the training and how far the training has got. But I must ask Matt Rack what the perspective of the FBU is on the training, and also what the current feeling is of the FBU about the new policy note 633 on firefighting in the tall buildings and all those associated 790, the other policies. Are you content now with the way that the training is going? Do you want to just fill us in on what your members are saying to you about the policy notes and about how the training is going?
Yeah, I don't think the issue for us is one particularly of training, it's of the policy itself. I think people may, clearly people will have views about how training is delivered during the pandemic, and may think that actually the way the training has been delivered is fine. That's, I think, a completely different issue as to whether people think the policy on which they are being trained is safe or necessary. And I think we know that there are some pretty fundamental differences between us and the brigade on the question of high-rise firefighting. If I can refer back to what the Commissioner said, what has emerged from Grenfell Tower is an alarming and shocking story about building safety in Britain, but it actually shouldn't be shocking. We as a union made warnings as long ago as 1999 about external cladding systems. I think Andy is right to highlight that, and we've made this clear, as others have, that it's not simply about cladding systems, it's about a complete failure to comply with the requirements on compartmentation. And of course, firefighting has evolved based around, firefighting tactics and strategy have evolved over the years in relation to what the expectations are on buildings and how they would behave in fires. Grenfell has highlighted that that's not what is that's not the reality in the real world of the built environment, but that should not have come as a surprise, because there have been a whole number of warnings, and I have to say, including to the London Fire Brigade. The London evidence at the inquiry has demonstrated very clearly that departments, certainly within the London Fire Brigade, were well aware of the risk of rapid spread of externally clad buildings, and that evidence was presented to the inquiry. Worryingly, while some parts of the London Fire Brigade knew that, the people on the front line were not aware of that, and that question was put to frontline firefighters in the inquiry. They had no such training. That is a failing which I think collectively people need to face up to. But our concern is about downgrading of safety measures in relation to the use of breathing apparatus. Safety measures which have been built into the British Fire Service since at least 1958, following a very famous fire in London, the Smithfield fire in 1958, which around which we as a union campaigned, and which has set the benchmark for how firefighters should respond in the use of breathing apparatus, and there's training systems that, the safety systems that should be built into that. I've dealt with many deaths of firefighters over my time, and many of them relate to the use of breathing apparatus. So we are very concerned about it. We think it's a national issue. I think there are failings at a national level to tackle how we deal with these failings in the built environment. I mean, interestingly, at the end of phase 1 of the inquiry, we said that an urgent recommendation should be made for a national review of issues around high-rise firefighting and mass evacuation. That was not taken up at the time by the chair. That delayed things unnecessarily. There is a review led by the Home Office. Interestingly, they don't seem to, as far as we can see, to be able to reach any conclusions yet, because actually the problem is such a massive problem.
Yeah, I mean, I think most of us who are involved in this meeting today, you know, and aware that there was the big discussion about the situation for so many trapped in blocks on Monday in Parliament. You know, we've had since 2010, you know, the bonfire of health, red tape around health and safety. And so there's been a bit of a litany of occasions when, you know, things could have been improved. And I think that's the wider picture. And I think we would support that. And certainly the Assembly produced, as you know, the report on the La Canal House fire. And again, you know, that was all about the failure of the fire compartmentalisation. Rather than specifically, you know, we've spoken many times about sprinklers, but just keeping the focus. Whilst we might agree with all of that, keeping the focus here on the training. That's good that you're saying that you think that the training is in and of itself is going well. Your major thing, I think, is whether the policy notes in the context of the current failure to take urgent action to improve buildings, whether that the revised policy notes are what the FBU would want to see. Would that be a fair summary? I'm trying to.
I think, as I understand it, the policy risks placing firefighters at unnecessary risk, going without adequate personal protective equipment, placing them in what in other circumstances they would be required to be wearing breathing apparatus, and that's our problem. You may be aware that actually just, and I think we've written to certainly the brigade, and I don't know if every Assembly member's had it. We as a union have just recently published the first part of a report on impacts of contaminants on the health of firefighters. It's the first such, I mean, I'd say alarmingly, the first such study on this scale in the UK. But actually, we have identified that in terms of a survey, very significant people returning to the survey have identified that certainly indications of much higher levels of cancers among firefighters than exist in the wider population. Now, that clearly is only on the basis of survey. That would require further scientific research. But I think if you take the debate around Grenfell, the question of toxins in the environment in the aftermath of that fire are of great concern to both the local community, but also, in our view, of firefighters who attended that incident. I'm not sure what work has been done in the London Fire Brigade about that aspect of this. I don't know how anything can have been done because it's still research that is underway. But this is not just about fires and whether people are breathing irrespirable atmospheres. It's what other impact on their health can be had as a result of attending firefighters without or being placed into positions without adequate PPE.
Matt, could you send us a copy of that report you mentioned on contaminants? Because I don't think we've seen it. And the point you make about cancer, I mean, when I was working for firefighters 30 years ago, we were picking up then a growth in cancers, particularly bladder cancer, I think. Back to...
Yeah, I think it would be really helpful if we could have a copy of that report. Certainly, I mean, this is all very cutting edge, I think, because the Environment Committee, I was contacted actually because I was chairing it by some local people around Grenfell with those concerns. And I think our ability to understand the size of small particulate matter in the air in general in London has really improved. But I'd like to come back to Richard Mills, if I may, because I think some of the, I mean, I mentioned the 64-metre ladders. Obviously, you know, the boys with toys and girls with toys. You know, ladders may, of course, help with the rescue with people not then having to enter into the building environment. But there's also, I think, the proposal that new drones be introduced, which will be able to carry smoke hoods. And I wondered if you could tell us a bit more about, you know, how the exercises are going in using these new devices, because the use of drones, I think, is a very interesting and very welcome development. You can also use them to observe from a different position, but if they are able to carry smoke hoods and things like that in, then you're able to enter the building in a completely different way. And I wondered if you could talk about what's going on with the training on those as well. That would be very helpful. And Commissioner, I'll then bring in the Commissioner, I think, because he's indicating he wants to come back in on this. Okay, Richard Mills, if I may.
Okay.
Sorry, did you want to come in completely? Sorry, I'm confused now. I think I'll stick with Richard.
Please let Richard answer your specific question. He's best placed to. I just wanted to make a point actually about Matt's
comment.
Information given around the report, because actually we thought it was a good report, but I'll come back to that, so please.
Okay.
Thank you.
Thank you, Commissioner.
Okay, Richard.
So in relation to the drone, so the drone has been in place for some time. Obviously, that was one of the recommendations around situational awareness. We have an ability not only to provide situational awareness on the incident ground, but also now directly alive feeding in control. Part of those trials was about a loud hailer capability, so about warn and inform of people that may be trapped in buildings, which we have developed, and that's in place. Likewise, when we look at the ability for it to carry and deploy items such as smoke hoods, such as life-saving devices for flooded areas, etc. and so forth. So that has taken place. We still have a small team able to do that, but they're available on an on-call arrangement to deploy to large-scale incidents. So we have put that in place. Before I obviously hand over to the Commissioner, in relation to some of the work we have done around contaminants. So in relation to Grenfell, we are working with the Royal College of London, and we have done a campaign internally to encourage firefighters and officers and those that attended, not only during the night of the incident, but throughout the whole incident there, because we were there for a protracted period, to go and be part of a study around health and wellbeing about those people that have been exposed. So we are aware of the effects of Grenfell, and we are trying to help support some of that work going forward with the Royal College of London.
Thank you, Richard. Commissioner, you wanted to come in on a couple of...
It builds on Richard's point, actually. So if we start with the contaminants report that the FBU sent us, and every other chief rightly in the country. So I think as the largest whole-time brigade in the country, we've got a responsibility to try and drive best practice nationally. We're very interested in anything that evidences a risk to our firefighters. So I'll give an example. So we've been conducting very large-scale physiological trials led by Professor James Bilson into the physical effects of high-rise firefighting, both under air and not under air, as we would describe it. Those have been ongoing, 24 full-scale trials in sort of 50-storey blocks in London, even through the pandemic. Pleased to say that the FBU supports that, recognises the expertise of the professor in delivering that piece of work. So that's one example of where we're looking at the risks, trying to gather better evidence about what those risks are, and using that to kind of inform national developments. And central government has real interest in that now, and we are likely to attract funding to extend that. In respect to the contaminant work, we thought the report was really well evidenced, a really good bit of work. We welcomed it from the Fire Brigades Union. It mirrored much of what we started a number of years ago internally, again in partnership with the London region of the FBU. Tim, you might be able to provide some detail, but I'm aware we've met with regional colleagues who in the union have responsibility for health and safety, and my understanding is we intend to implement the recommendations as stated, because we were already a long way along that road on the basis of our own kind of evidence gathering out. And the trial that Richard's referring to is Imperial College London of doing a very large-scale health monitoring trial on all the emergency responders who attended the Grenfell Tower incident. Richard himself has been up there, I'm due to go up there to have my blood taken and to consider the possible exposure to contaminants. We know it's a live issue and we take it very seriously. So, Tim, perhaps you could provide just some details to reassure the committee about how seriously we take this and what we recognise as a useful report from colleagues in the Fire Brigade Union.
Yeah, that's quite correct, Andy. And just so you know, we've got a meeting with Professor Bilson next Monday on the 8th of February, where the initial findings of the work that he's done are going to be presented to us. What we're going to do is we're going to build those findings into the health and safety panel that's been set up with the FBU to look at the high-rise concerns and issues that the FBU have raised with us. As we know, we've got a very eminent chair who's going to take that on, Andrew Strawson, who is well known to both FBU and ourselves. And that panel will look at both representations made by us and the FBU, as well as the input from those physiological trials that Professor Bilson has run. So we'll know the outcome of all of that, in the next month.
Thanks, Tim. In relation to the contaminant reports, I don't know whether it's Richard or Tim. My understanding is we had a meeting reference the FBU report, and that Dr. Adrian Bevan, Head of Health and Safety, recognised the majority of the recommendations, and I was told that we were moving to implement.
That's quite correct, Andy, and that's been run through the Joint Health and Safety Committee that both us and the FBU sit on.
So
Matt wanted to hang on, Leonie. Matt wanted to come in, and then Tony Arbour wants to come in as well. Matt.
Yeah, just a few quick responses. In terms of physiological research, we welcome that. I mean, there is, and I'm sure this will update knowledge, but for those who may not know, there is research going back into the 1980s that actually one of the issues with the wearing of breathing apparatus and other firefighting equipment is that it has very rapid impacts on the physiology, including the ability to make judgment, for example. So previous studies have identified that in a very short space of time, people's ability to make quick judgments is possibly impaired. So that this is the level of why these matters are serious, when particularly if you're putting people into very high-rise firefighting. In terms of other research, just a comment. I don't know. One terms about research, and I make no comment whatsoever on the research that the LFB has commissioned at all. However, something that we are extremely concerned about is the impact of potential commercial interests in research. The truth is, universities are increasingly commercialised, seek sponsorship from businesses, and I think people, when commissioning research, have to take those matters into very serious account, and hopefully you've done that. In terms of the testing, I think one concern that has been raised with me is that actually, if we wanted to test people after Grenfell, it should have been done within a day or so of the incident. To testing people at this stage, there will be information that has already been lost. And in terms of, finally, just in terms of the recommendations, we've had an initial meeting with the Health and Safety Executive regarding, I welcome the comment from the Commissioner and from Tim about the discussions at the Joint Health and Safety Committee. I don't think there's anything in those recommendations that is particularly controversial at all, and we should be able to easily progress those. And in terms of that research, the final point, sorry, apologies, Chair, is that's ongoing for another 18 months or so. I think the next phase will be, what we don't have is accurate records post-retirement on the health of firefighters across the UK. So we may have people who may die as a result of cancer. The death certificate may not record that person was previously a firefighter. So that raises. I think this is something that we all need to think about. We'll make an announcement later this week with the University of Central Lancashire about how that might be improved. But you can obviously see that there will be, for example, thousands of former London firefighters who, at the point at which they do become ill or die, it may not be shown that those people did used to work for the London Fire Brigade. That's something that I think we all need to work together and think about how we can address.
Well, presumably we know who they are because they will be getting their pensions. So maybe, Tim, we ought to be writing to people who are our pensioners and saying, please let us know. Not when you're dead, but make sure that we know if you get any symptoms. Tony wanted to come in.
Yeah. We've been hearing a lot about 21st century equipment for dealing with fires, drones and the ladders and all the rest of it. I wanted to ask you about the use of something which is quite Victorian, which is costing us a great deal of money, or rather costing Londoners a great deal of money, which is waking watches. And I'd like to ask the Commissioner if he can think of a single case where the waking watches, which have been introduced subsequent to Grenfell, have actually prevented any fires.
Thank you, Assembly Member. I mean, it's quite difficult to, you know, and I'm not being facetious in this, to understand when something's been prevented, to know when there's been a record of that, because actually we won't be provided with that record. It's not our responsibility to maintain the waking watch. That's the responsibility of the building owner, and therefore there may well be many circumstances where a fire has either been seen early on or actually has been prevented because of the action of those waking watches. What I would say is, in the absence of a simultaneous alarm evacuation system, which some buildings are now bringing in to replace the waking watches, the safest thing for those people is to have someone on site with eyes and ears, you know, ready to identify any risk that might emerge, whilst we wait for that building to be remediated, which must be the real resolution to that issue. So I'm afraid don't see them as a waste of resources, because I think they are what are keeping people safe in very unsafe buildings until those buildings are fixed, which in some cases can take a long time. So I think whilst there are some questions about the standard of some of those waking watches, and that's why we visit on a weekly basis those buildings with waking watches to try and make sure that those are in place in a way that meets the guidance laid out in respect to them. I think they are, unfortunately, whilst expensive, the only way you can mitigate that risk at the moment, alongside simultaneous evacuation systems, until those buildings are fixed. I do not see another option.
Well, I understand that, and I'm actually quite surprised by that response, that you think that the waking watches are worth having. So far as your non-facetious response is concerned, truth of the matter is, isn't it, that usually if somebody has been successful, they're likely to boast about it, and I'm hard put to imagine that waking watches, or the people who are organising those waking watches, would not have come to you and to the local fire brigade to say, look, we've managed to stop this one. But nevertheless, I'm intrigued by your substantive reply.
I can't comment on that particular Assembly Member, but what I would reflect on is that we face a number of very, very serious fires in buildings with similar issues as those buildings that have waking watches on. For example, Barkingside, Worcester Park, where we saw the rapid kind of deterioration of a building without a waking watch, actually, and actually how close that came to, unfortunately, having very serious numbers of casualties. You know, members of the public being evacuated at very quick notice because of a combination of luck, really, in both of those circumstances, where actually, you know, you are really gambling with people's lives at the point a fire takes hold in one of those buildings as they begin to fail. Worcester Park, 23 flats burnt to the ground in 11 minutes. Approximately 6 or 7 minutes for the whole of the back of the building to come off in Barkingside, where it spread through the balconies. I understand your point. We don't have the kind of data to be able to provide you an answer. So I genuinely wasn't, you know, trying to be flippant on that. I wouldn't be that discourteous. But from my perspective professionally, it's important that any building that is identified as dangerous in that way, because we've seen exactly what can happen in those buildings now, from Grenfell to Worcester Park to Barkingside to the 15-pump fire we had in Southwark only a week or so ago, a couple of weeks ago. We think that's the appropriate response at the moment. I think what really needs to happen is an energy from all stakeholders, you know, whether it's the fire service, central government, local authorities, developers, is to really put the effort and the funds into getting those buildings sorted out, you know, whether it's the cladding off or remedial compartmentation work done. That is the answer ultimately, because I do accept that it is a great burden on leaseholders. I would not want to be in that position myself, but I think in the absence of that remedial work being done and an agreed pathway to fund it, you know, to reduce the burden on leaseholders, I think it's very difficult to see an alternative.
Okay.
Thank you very much.
Matt wanted to come in, Tony, and also Fiona, so I'll bring you back after that. Matt. You're muted. Matt, you're muted.
Sorry, apologies, Chair. Yeah, I think it is a very good question. I think we have expressed our concerns about the Waking Watch system, which is a recommendation that the National Fire Chiefs Council have endorsed. It's not one that we share. I think the difficulties were set out in the question. It was fairly obvious that if a system of waking watches was introduced in this way, it would result generally in poorly trained people being put into positions with a responsibility for the safety of residents. I think there are a whole number of anecdotes which you can see, anecdotal evidence which you can see on social media, for example, of supposedly waking watch protection that isn't actually there, people being absent, people signing books saying that they are present but actually not being present, and the tenants and leaseholders actually identifying this. There is then the cost which is being added to the leaseholders, in many cases completely unfairly, and I think it is a completely inadequate system for providing for safety. It's been described as a temporary measure. I'd remind people we're coming up to the 4th anniversary of Grenfell. The Commissioner says that you know, we need to go on as quickly as possible and remediate these buildings, but I don't know what the timeline for that is. You know, a temporary measure that is in place for 4 years and possibly 5, 6 or 7 years, frankly, isn't a temporary measure, nor in our view is it adequate to provide protection to residents in those circumstances.
Okay, and Fiona wanted to come in.
Thank you, Chair. I think when you see that Matt Rack and Tony Arbour agree on something, you can see that we really need to have action very quickly on this. Waking Watch has been a really unfortunate necessity. It isn't something, as Matt Rack outlined, that anybody would have wanted to see almost 4 years after the Grenfell Tower. It is about the absolute appalling condition of a huge degree of our built environment, and I think that the government has recognised this with the belated introduction of the Waking Watch Relief Fund. However, we need to make sure that this is funded adequately, and that alongside this fund you see much quicker action on cladding remediation and on other issues in the built environment being addressed. Just to stress, it is the building owners who determine that they should have a waking watch. It isn't the decision of the fire brigade, although obviously it's often done in conjunction with discussion with the fire brigade. But I think, like pretty much everybody, we would want to see a rapid conclusion to waking watches being seen as a solution. This should only ever have been interim, and these issues should have been dealt with much sooner. Thank you, Chair.
Thanks. Tony? Tony? Oh, right, finished. Okay, back to Leonie. Leonie.
Thank you, Chair. I mean, I think in sum, it sounds to me as though the training is going very well, that we are still looking towards moving forward from the end of March, but that all of us, on a cross-party basis across the entire committee, the FBU and the London Fire Brigade, still have concerns about the lack of speed moving forward to make things like Waking Watch completely unnecessary, and really sorting out where we are with health and safety in a number of our buildings. But I'll leave it there, Chair. Thank you very much, and thank you very much to Matt Rack, the Commissioner, Tim Powell and Richard Mills for your answers to my questions. Thank you.
Okay, thank you. Just a quick one from me, Richard. Are all the 364 metre ladders now delivered?
Yes, there was a slight delay earlier on in the year due to COVID. We've got the 3 aerial ladders in the UK now. One's up in Scotland and 2 are down in London. We did some trials last week with colleagues from Fleet, and we are carrying out the training that's taking place before we deliver the training to the front line. Plans are for the first aerial to go into service in June, the second one in October, and the third is in August. And the locations are Old Kent Road, Wimbledon, and one escapes me, so I apologise. It's not on the forefront of my head.
I think it's Dagenham.
I think it's Dagenham.
Yes, thank you. Thank you very much. Yes, you're correct.
What about North West London? Don't we get one?
No, you'll have to come to Wimbledon, Andrew, if you want to. You want to see it.
Just your assurance, Chair, we position them in the most strategic locations for response.
Oh, right, okay. Well, don't forget where Grenfell was, North West London.
It's about where we can make the best coverage across London.
Okay, thank you. Well, I think, Susan, you indicated earlier on you want to do supplementaries on this. Have you got any questions?
No, thank you, Chairman.
Okay, well, in that case, I think we're through. So can I thank all our guests for your contributions. Committee, can we note the report and today's discussion?
Noted.
Can we also delegate authority to me as chair in consultation with party group lead members to agree any output from the meeting?
Agreed.
Thank you. Okay, so that our guests can now leave us if they wish, or they can hang around for the rest of the... Andy wants to say something.
I just wanted to thank you personally, Chair. You know, you've been involved with the London Fire Brigade for many, many years. You've provided effective scrutiny for many years, and I would like to extend my thanks to both yourself and Assemblymember Arbour, who are due to, lead the committee. This is your last committees, respectively. I want to thank you both for your service to the people of kind of London, but also to the brigade in asking those challenging questions and, making sure we're delivering the service we need to. And I just thought it was incumbent, really, just to thank you for that. I think you've done a great job. You've always provided us with a serious challenge. That's what you're there to do. And I know that I speak on behalf of everyone in the London Fire Brigade when I make those thanks. And I look forward in your last few months as chair of the committee to enable you to come and see whatever you need to, COVID, notwithstanding, really just to kind of confirm your legacy. So thank you.
Well, thank you for that, Andy. I started with the union, I think, on the 1st of October 1978 was my first case for the union. Well, over 40 years, I guess. Susan wanted to come in.
Yes, thank you. Actually, Andy, you beat me to as deputy chair of this committee. I'd like to especially thank you, Chair, for all the work you put in over the years, and with ELFBIPA, which Tony Arbour and I remember well. Tony remembers far more years than I do. So thank you for all the work that you've done in this committee, and we're really, all of us, very, very grateful. Thank you.
Thank you. Fiona.
Yeah, sorry, I'm going to join this this chorus of thanks to you, Andrew. I think that I'm genuinely sad that you're not going to be on the Assembly after the elections in May. And I've got particular gratitude to you, Chair, because you really did help me find my political feet when I was first elected to the Assembly in 2012. So for me, I've got a real personal gratitude, as well as obviously your long service to London, not least on fire over many decades before you joined the Assembly. Personally, I'm also going to miss Tony Arbour winding the Commissioner up. I was very disappointed when he didn't rise to your bait the first time you did questions this morning, but I think it's been great working with you as well, Tony, and look forward hopefully to working with everyone else on the committee after the elections in May. But thank you particularly to Andrew.
Oh, thank you, Fiona. Matt. No more.
It's a mad rush to congratulate everyone. Well, best wishes to both departing members for us, if I may, Chair. And just in terms of yourself, Andrew, you've mentioned it, but obviously you have a long history with the Fire and Rescue Service, originally with us in the Fire Brigade Union, and I think have been involved in some very, very high profile cases that have actually changed the direction of the fire service and have improved safety for firefighters. And that for that, and your work with us before you came into this role, we certainly thank you. We'll pass that on in another forum, but thanks very much, and best wishes to both of you for the future.
Well, thank you, Matt. Okay, that's enough. Thank you. Right, let's just finish off the. We'll finish off the official business. So guests can leave if they wish. Or they can wait and see what happens. Statement of assurance. We now move on to the Statement of Assurance 2019-20, prepared by the London Fire Brigade in accordance with the Fire and Rescue National Framework. This document comes to the committee in accordance with Section 327I of the Greater London Authority Act 1999 as amended. In a moment, I'll ask if members wish to make any comments on the Statement of Assurance. Once the committee has discussed the document in accordance with the Act, the committee must make a report or recommendations to the Mayor. Do members have any further comments? I know we've had some offline discussions on this already.
No.
Great, okay. In that case, can we note the Statement of Assurance and agree that this forms our recommendations to the Mayor of London in accordance with Section 327I of the Greater London Authority Act 1999 as amended, and that the committee makes comment that the next Statement of Assurance must outline how the LFB has sufficient resources to fund the delivery of its transformation programme and how it is working to secure greater collaboration across the GLA group and with other emergency services. Is that agreed?
Noted.
Thank you.
Agreed.
Okay, and then I should summarise any additional comments, there haven't been any, and ask the committee to agree that this forms the recommendation to the Mayor of London on the document set out in accordance with Section 3271I, of the Greater London Authority Act 1999 as amended.
Agreed.
Okay, delegation of authority to the Chair. Can we approve in relation to urgent matters only a general delegation of authority in respect to the committee's powers and functions, apart from those that cannot under the GLA Act 1999 as amended again, be delegated to me as Chair of the committee in a consultation with the party group lead members from the close of this meeting until the annual meeting of the London Assembly scheduled to take place on the 14th of May 2021.
Agreed.
Date of next meeting, the London Assembly's annual meeting due to take place on the 14th of May 2021 will decide which committees to establish for the 2021/2022 Assembly year and a timetable of meetings for those committees. And finally, I have no other urgent business other than to thank everybody on the committee for all the support and contributions you've made the time I've been Chair, assuming that the elections go ahead.
Yes. Oh, you're not making a prediction on that front then, Chair?
I wouldn't make a prediction on that, but
thank you,
anyway.
Chair. And also to Tony as well.
Yes, I'm looking forward to retirement. Cross fingers.
Thanks very much.
Okay,
Bye-bye.
end of meeting. Thank you.
Bye-bye.